Hi all, I'm Professor Dragan from the School of Public Health and Preventive Medicine, and welcome to this brief presentation in which we're going to cover the essentials for your upcoming critical appraisal task on harm. And this particular presentation relates to those of you who decide to choose a case control study. So, as I mentioned in the previous presentations, what I'll do is just run briefly through the critical appraisal task, offer a few tips as we go along. The first section is very similar to last semester's critical appraisal task of therapy, where we focus on the methodology. We then will focus on the results and then talk briefly about a new section around diagnosis as well. So the first part relates to the methodology, titled Are the Results Valid? So if you decide to choose a case control study, please use this template. The first question relates to how the cases were defined and the controls chosen. So spend a bit of time, I'd suggest a paragraph or so, maybe two, highlighting the differences in terms of the approaches of how cases were identified or recruited or defined in terms of eligibility criteria, and similarly how the controls were chosen. So the controls being participants that were hopefully as similar to the cases in every facet possible, apart from the fact that they don't have the case of interest. The second question relates to the exposures and how they were identified across the two groups. So once again, we want to ensure that essentially this outcome assessment, so detection bias, is kept to the minimum. So we want to identify how the study authors identified the exposures across the two groups and whether or not that was consistent in terms of the approach that they used. So did they refer to medical records, participant interviews, other ways of collecting the data? Whichever way that they approached it, it should be consistent across both groups. If not, then there's the potential for detection bias for that particular question. So question 4, did the investigators measure all known confounders in the cases and the controls? So basically this is looking at selection bias in terms of how participants or the case controls were selected. So quite often for case control studies, you may find a little bit of ambiguity or differences between the cases and controls. That's okay, as long as they've been adjusted for in the analysis and the study authors have identified that yes, there may have been more males than females, but we've adjusted for it using XYZ procedures. That is fine. If not, then you'd want to highlight any differences between the two groups. So if you refer to, usually it's table 1, the demographics table, you'll be able to highlight any differences between the two groups of interest. Lastly, what type of case control study was performed? So looking at the type of study design, so was it nested within a randomized controlled trial? Was it a case control study standalone? How did they go about recording their data? So was it linked to databases, and how I guess secure or how confident are you that those databases are correct in terms of the way in which they've collected data? Question 2 revolves around the results. So for case control studies, we want you to report the odds ratio. So sometimes authors will I guess convert their odds ratio to a relative risk. Typically we don't find it, but it is possible to do so. We use odds ratios in case control studies because we don't have incidence. So in order to calculate relative risk, you need to have incidence. So, like I said, though, sometimes in case control studies, the authors may use a statistical procedure to convert it over to relative risk. It allows them to do a variety of analyses. For the purposes of your study, please report whatever statistical outcome is reported. In doing your 2x2 table, I'd suggest that you then calculate your own odds ratio. Now, sometimes the odds ratio that you calculate may be different to the one that's reported in the paper. That's fine. As I said earlier, sometimes the authors may adjust for differences between the two groups, so that's why your odds ratio may be a little bit different. How strong is the association between exposure and outcome? What we're wanting you to do here is to interpret the odds ratio. So if the odds ratio is 1.15, being able to interpret that there's an increase in the odds of having whatever outcome it is by 15%. So the odds increase by 15% of having outcome XYZ if you're exposed to drug A, for example. How precise is the estimate of the risk? What we want you to do there is discuss the confidence intervals, so how wide or how narrow they are, what they can tell you about the sample size, and what they can potentially also tell you about the statistical significance, whether or not it's present. Section 3 is the new section that we've included for studies around harm, and this relates to identifying whether or not some of the diagnostic tests for causation are apparent. So the first question relates to identifying whether or not the exposure preceded the onset of the outcome. So in order for causation to be present, we have to demonstrate that the exposure preceded the outcome. So the exposure caused the outcome. Is there a dose-response gradient? So as I've said previously, if your study is one that has the exposure or factor being a drug, drugs can typically increase in their doses, and by that very nature, we may be able to see an increase in the outcomes in terms of the severity of the outcomes. Now, a lot of the studies may not, you may not be able to identify a dose-response gradient. That's fine, as long as you explain what it is and why it's not possible. You'll get full marks for that particular section. The third item is identifying whether or not there's evidence from a de-challenge, re-challenge study. So once again, identifying whether the presence of the exposure causes the outcome of interest. So if we're looking at a drug and we give drug A and the patients have gastrointestinal side effects, what happens when we remove drug A? Do the side effects also remove? Again, because it's a case control study, because the outcomes have already occurred, and because it's retrospective in its design, it may not be possible to demonstrate this de-challenge, re-challenge strategy. Again, as long as you highlight and explain what the de-challenge, re-challenge strategy is and why it's not possible in your situation, you'll be eligible for full marks. So item 4 really pulls everything together in terms of identifying how good, bad, or otherwise your methodology of your study is, and then coupling that with the results to identifying what you would do for your patient scenario. The first question is identifying whether the patient's similar to your patient. So were the patients in the study similar to your patient or patient scenario? Again, they don't have to align perfectly, and as long as you highlight that yes, there was a great applicability, or no, there wasn't, you'll be fine in terms of getting the necessary marks. What was the magnitude or seriousness of the risk? What we're wanting you to do here is to highlight what the number needed to harm was and interpret the number needed to harm. This last question is really looking at pulling everything together and saying, look, on the whole, are there any benefits that may offset the risks of the exposure, or should we be stopping the exposure in the patient of interest? So the next couple of slides really relate to how you should set out your assessment appraisal. So the first part again is very similar to semester 1, where you provide a brief clinical vignette, define the information gap, identify the PICO components, and then construct the answerable question using the PICO elements. Conduct a search of Medline, but before you do so, please highlight which other databases you may have used in order to get any information. And just a quick tip, please don't say that you would use Medline and PubMed, because they're the same database, they're just different interfaces. Once you've conducted your search, feel free just to have a screenshot of it, copy it and paste it in your study. Then identify the studies that you've returned in your search, and then just a one-liner in terms of explaining why you've chosen to exclude certain studies. Finally, about a paragraph or so highlighting why you've chosen to appraise your particular study. Try and relate it back to the clinical scenario as well as the evidence pyramid. Before you submit, also download a copy of your article, and please try and download it in PDF form if possible. So part 2, here's the due date. The word limit's about 2,000 words. Please submit it through the Year 3 Moodle site, and please submit a copy of your assignment and the article. So your assignment should include both parts. So the first part around your vignette, your search strategy, etc. The second half, the critical appraisal using the template that we've provided. Try and do that in the one Word document and upload that to the Moodle site. Your attachment should include the PDF. Feel free to attach any other supplementary information. So if it was part of a broader study which provides more information on the methodology, feel free to attach that information as well. You'll receive a Turnitin score. You can submit as many times as you like. Don't worry if your Turnitin score is slightly high. We realise that everyone's using the same template, so the Turnitin scores will be elevated. If there's an issue with that, we will certainly contact you. If you're appraising the case control study, please submit your assignment using the link which says case control study in Moodle.